The alarm goes off at 7:15. You reach over, silence it, and swing your legs over the side of the bed. You stand up. You walk to the bathroom. You turn on the shower as hot as it goes, step in, and start your day. In the next 90 minutes, you will do several things you have done every morning for decades. Habits so automatic, they require no conscious decision. Movements so routine, they feel like the least dangerous part of your day. And somewhere in that sequence of ordinary actions, if you are making the mistakes covered in this video, you are doing something that the research now identifies as the most dangerous window of the entire 24-hour cycle for the cardiovascular system. Not the middle of the night, not the afternoon when stress peaks, the morning. Specifically, the period between waking and 2 hours after waking is when the majority of heart attacks occur. Not because of coincidence, because of a specific and well-understood cascade of physiological events that unfolds every morning in every adult body. That creates a window of genuine cardiovascular vulnerability, and that certain common morning habits push past the edge of what a compromised cardiovascular system can safely manage. A landmark analysis published in Circulation, the Journal of the American Heart Association, reviewed the timing of cardiac events across more than 26,000 patients. Heart attacks were nearly 3 times more likely to occur between 6 and 10 a.m. than during any comparable 2-hour window in the rest of the day. The peak was not random. It corresponded precisely with the morning surge of cortisol, the spike in blood pressure that accompanies waking, the increase in platelet aggregation that makes blood more prone to clotting in the early hours, and the activation of the sympathetic nervous system that pushes the heart into a higher demand state before any external stress has occurred. This morning, vulnerability exists in everyone. What determines whether it passes safely is the baseline health of the cardiovascular system, and whether the habits layered on top of it are adding to that vulnerability or neutralizing it. The 7 habits covered today are the ones that consistently push the morning cardiovascular window past the threshold of safe management in people who do not know they are doing something dangerous. The 7th is the most surprising, because it involves something most adults consider beneficial. The first is the habit that cardiologists describe as the single most consistent, modifiable risk in the morning window, present in the routines of adults who experienced cardiac events and who had no idea that what they were doing every morning was loading a cardiovascular system that was already under maximum morning stress. Before we begin, tell us in the comments right now, how old are you and where are you watching from? And do you have a consistent morning routine you follow every day? Drop it below. We read and respond to every single comment. Number 7, standing up too quickly from bed without allowing the cardiovascular system to adjust. This is the morning habit that happens in the first 15 seconds of the day, before any conscious decision has been made. And it is one that most people have never considered as having any connection to cardiac risk. When you are lying down, your cardiovascular system has spent 7 or 8 hours in a configuration optimized for horizontal rest. Blood pressure is at its overnight low. The vessels of the legs are relatively full of blood that does not need to fight gravity. The heart is beating slowly and with less force than it will during the day. The moment you stand, the entire cardiovascular system must rapidly reconfigure. Approximately 500 to 700 milliliters of blood shifts from the upper body and chest down into the legs and abdomen due to gravity. The heart suddenly has less blood returning to it. Blood pressure threatens to drop. The baroreceptors that sense this shift send an emergency signal to the nervous system. The sympathetic nervous system fires. The heart rate jumps. Blood pressure surges. The adrenal glands release a pulse of cortisol and adrenaline. In a young adult with a healthy cardiovascular system, this entire sequence occurs so smoothly it is imperceptible. In an adult over 60, whose baroreceptor sensitivity has declined, whose vascular compliance has reduced, and whose morning cardiovascular state already includes the natural cortisol surge and platelet activation that characterize the waking window. The same sequence can produce a blood pressure spike that exceeds what the coronary vessels can safely accommodate. Orthostatic hypotension, the drop in blood pressure on standing that precedes the compensatory surge, is present in approximately 18% of adults over 65 and is directly associated with increased cardiovascular event risk. A study published in the Journal of the American College of Cardiology found that adults with orthostatic hypotension had a 40% higher risk of major adverse cardiovascular events over 5 years compared to those without it, independent of other cardiovascular risk factors. The adjustment that eliminates this risk costs nothing and takes 30 seconds. Sit on the edge of the bed for 30 seconds before standing. Allow the cardiovascular system to begin its reconfiguration while you are still partially supported. The blood pressure surge that standing triggers is no less traumatic, but the nervous system has had enough time to begin its compensatory response before the full gravitational challenge arrives. Number 6. Taking a very hot shower immediately upon waking. The cardiovascular consequences of immediate hot shower exposure are specific enough to be worth understanding. Because the shower feels relaxing, and the association between relaxation and cardiac safety feels intuitive. The physiology runs in the opposite direction. When the body is exposed to hot water, the peripheral blood vessels dilate rapidly. This vasodilation is the mechanism behind the sense of relaxation that heat produces. Blood rushes to the skin surface. The peripheral circulation expands, and the cardiovascular system, which was already navigating the morning surge of cortisol and sympathetic activation, must now manage a sudden redistribution of blood volume to the periphery while maintaining adequate perfusion to the brain and the coronary arteries. The heart responds to this redistribution by increasing its output. In adults with clean, flexible coronary arteries, the increased cardiac output is met without difficulty. In adults with any degree of coronary artery disease, even subclinical disease that has never produced a symptom, the demand placed on the coronary circulation by the combination of morning sympathetic activation and hot shower-induced vasodilation can exceed what the narrowed vessels can deliver. This mechanism is the explanation behind the well-documented cardiovascular risk of extreme heat exposure in older adults, and its morning-specific version is particularly relevant because the cardiovascular system is most vulnerable to demand-supply mismatch during the morning window. A study published in the European Heart Journal examining cardiac event timing found that cardiovascular events associated with bathing occur disproportionately in the morning hours and disproportionately involved hot water exposure, with the risk most concentrated in adults with known or suspected coronary artery disease who maintained a morning hot shower habit. The practical adjustment is to allow the shower to be warm rather than hot, and to begin with a temperature that does not produce the immediate peripheral vasodilation that the maximum heat setting creates. The difference between a warm shower and a hot shower is measured in degrees, but the cardiovascular demand it creates is measured in the pressure change that the heart must manage while already under morning cortisol load. Before we continue, if this has been useful so far, hit that like button so more people can find this information. Subscribe and turn on notifications. Number 5. Vigorous exercise within the first 30 minutes of waking without any warm-up. The relationship between exercise and cardiovascular health is unambiguous and deeply positive. Regular physical activity is among the most powerful protective factors for the cardiovascular system available without a prescription. The timing and the approach to morning exercise, however, carry specific considerations that the research has made increasingly clear. The cardiovascular system in the first 30 minutes after waking is already under elevated demand from the morning cortisol surge, the blood pressure rise, and the increase in platelet aggregation. Adding vigorous physical exertion to this already elevated state without any period of gradual warm-up that allows the cardiovascular system to escalate from its overnight configuration to its exercise configuration in a controlled progression, creates a sudden demand that the coronary circulation may be unable to meet if any underlying vulnerability is present. Exercise-induced cardiac events occur disproportionately during vigorous morning exercise in the period immediately after waking, a pattern that has been documented consistently enough that sports medicine and cardiology guidelines specifically recommend against vigorous early morning exercise without an adequate warm-up period for adults over 50 with any cardiovascular risk factors. A study published in JAMA Internal Medicine analyzing the timing of exercise-associated cardiac events found that vigorous exercise in the first hour after waking was associated with a significantly higher rate of adverse cardiac events than the same vigorous exercise performed in the afternoon or evening, with the risk differential most pronounced in adults with hypertension, diabetes, or a history of high cholesterol. The protective modification is not to avoid morning exercise. Morning exercise has specific benefits, including its interaction with cortisol metabolism and its effect on blood sugar regulation throughout the day. The modification is to include a 10 to 15-minute low-intensity warm-up before any vigorous activity, allowing the heart rate to climb gradually, the coronary vessels to dilate in response to the increasing demand, and the cardiovascular system to shift from morning hormonal configuration to exercise configuration in a controlled and graduated progression. Number 4. Drinking coffee before drinking water. Dehydration overnight is universal and largely invisible. 7 to 8 hours without fluid intake, combined with the respiratory water loss that occurs during sleep, means the body wakes every morning in a state of mild fluid deficit. Blood volume is slightly lower than optimal. Blood is slightly more viscous than it should be. The cardiovascular system is working against a mildly elevated resistance caused by blood that is thicker than its ideal flowing consistency. This mild overnight dehydration is a normal physiological state that the body manages effectively in healthy adults. What is not neutral is the decision to add caffeine to this already mildly dehydrated state before any rehydration has occurred. Caffeine is a mild diuretic. It increases urine production by inhibiting the reabsorption of water and sodium in the kidney tubules. In a well-hydrated person, this diuretic effect is inconsequential. In a person who is already mildly dehydrated from overnight fluid loss, the immediate diuretic effect of morning coffee deepens the fluid deficit before the day has properly started. Blood viscosity increases further. The cardiovascular system must work harder to move thicker blood through vessels that are already under the morning pressure surge. And platelets, which are already at their daily aggregation peak during the morning window, are more likely to form the clots that trigger cardiac events in blood that is more concentrated and less fluid than its optimal state. A study published in the American Journal of Clinical Nutrition examined cardiovascular markers in adults who consumed coffee as their first morning intake versus those who consumed at least 300 milliliters of water before their first coffee. The water-first group showed significantly lower morning blood viscosity, lower platelet aggregation markers, and lower morning systolic blood pressure than the coffee-first group, despite consuming the same total daily coffee intake. The sequence mattered more than the quantity. The adjustment is to drink a full glass of water, 250 to 300 milliliters, before the first coffee of the day. This single change addresses the morning dehydration that coffee amplifies, reduces blood viscosity during the highest risk cardiovascular window of the day, and delivers the hydration the cardiovascular system needs before adding the sympathomimetic effects of caffeine to an already sympathetically activated morning state. Number 3. Skipping blood pressure medication until later in the morning. This is the habit that most people whose morning routine includes blood pressure medication have never connected to cardiac risk. because taking medication at a slightly different time feels like a minor scheduling adjustment rather than a cardiovascular decision. Blood pressure follows a circadian rhythm. It is lowest during sleep, begins rising before waking as part of the body's preparation for the day, and reaches its peak in the late morning to early afternoon. In adults with hypertension, this morning rise is typically more pronounced than in adults with normal blood pressure, a phenomenon called morning blood pressure surge that has been independently associated with increased cardiovascular event risk in multiple longitudinal studies. Blood pressure medications prescribed for daily use are designed to provide coverage during this morning surge window. When these medications are taken consistently at a morning time that precedes the peak of the morning surge, they are doing exactly what they were prescribed to do. When they are delayed, taken at midday or later because the morning was rushed, skipped entirely, or not taken until after coffee, exercise, and the peak of the morning cardiovascular demand has already passed, the morning surge occurs without pharmacological coverage. A study published in Hypertension followed adults with treated hypertension and tracked both their medication timing and their morning blood pressure profiles using ambulatory monitoring. Adults who consistently took their morning antihypertensive medication within 1 hour of waking showed significantly better morning surge suppression and significantly lower rates of adverse cardiovascular events over 5 years compared to those whose medication timing was inconsistent or delayed beyond 90 minutes after waking. The timing determined whether it was present when the cardiovascular system needed it most. Number 2, ignoring sleep apnea and allowing it to set the morning cardiovascular state. The connection between untreated sleep apnea and morning cardiac risk is one of the most well-documented in cardiovascular medicine, and it operates through a mechanism that makes the morning the highest risk period specifically because of what the cardiovascular system has been subjected to throughout the night. Each apnea episode during sleep produces a period of reduced blood oxygen, a surge in blood pressure as the cardiovascular system responds to the oxygen deprivation, and a burst of sympathetic nervous system activation as the brain attempts to restore breathing through arousal. In adults with moderate to severe untreated sleep apnea, this cycle repeats dozens to hundreds of times per night. By the time morning arrives, the cardiovascular system has been through a night of repeated pressure surges, sympathetic activations, and oxygen disruptions that have left it in a state of heightened reactivity and baseline inflammation that compounds the natural morning cardiovascular vulnerability. The morning cardiovascular risk in adults with untreated sleep apnea is not simply additive to the standard morning risk. It is multiplicative. The natural morning cortisol surge, blood pressure rise, and platelet activation are occurring in a cardiovascular system that has not rested overnight, that has been under intermittent hypoxic stress, and that has accumulated the inflammatory burden of a night of repeated microstresses. The threshold for a cardiac event in this context is lower than it would be in a cardiovascular system that had genuinely rested. A study published in the Journal of the American College of Cardiology found that adults with untreated moderate to severe sleep apnea had a cardiovascular event rate in the morning hours that was more than twice as high as adults without sleep apnea, with the risk difference most concentrated in the 6 to 10 a.m. window that represents the natural morning vulnerability peak. Screening for sleep apnea in adults who snore, who wake unrefreshed despite adequate sleep duration, or who have been told they stop breathing during sleep is one of the highest value cardiovascular risk reduction conversations available. CPAP treatment in adults with confirmed sleep apnea reduces morning cardiovascular event risk measurably and produces measurable reductions in morning blood pressure, morning cortisol levels, and morning inflammatory markers within weeks of consistent treatment. Number 1. Getting up and moving immediately into a high-stress mental state. This is the morning habit that is simultaneously the most common, the most consequential, and the most invisible, because it does not involve a physical action that anyone would identify as dangerous. It involves a mental one. Specifically, the immediate transition upon waking into the high-demand, high-stress mental state that checking news, reviewing emails, scanning messages, or rehearsing the stresses of the day ahead creates in the first minutes after consciousness returns. The morning cortisol surge that occurs naturally upon waking is a biological preparation mechanism. Cortisol rises to mobilize energy, activate alertness, and prepare the cardiovascular system for the demands of the day. This is appropriate and protective. What is not appropriate is amplifying this already elevated cortisol state by immediately introducing external psychological stressors that drive cortisol further upward before the cardiovascular system has had any opportunity to adjust. Cortisol, in the cardiovascular context, does specific and measurable things. It raises blood pressure through its effect on sodium retention. It increases the contractile force of the heart. It promotes platelet aggregation. It raises blood glucose. It activates the inflammatory pathways that contribute to the instability of atherosclerotic plaques, the plaques that, when they rupture, trigger the clot formation that causes heart attacks. Every one of these effects is amplified when external psychological stress is added to the natural morning cortisol surge before the body has had any opportunity to establish a physiological baseline for the day. A 2022 study published in the European Heart Journal examining the triggers of acute myocardial infarction found that psychological stress in the period within 2 hours of waking was the most commonly reported precipitating factor among adults who experienced morning cardiac events, present in more than 60% of cases. The stress was not exceptional. It was the ordinary stress of reviewing the day's demands, of reading distressing news, of encountering a difficult message. In a cardiovascular system already at its morning peak of sympathetic activation and platelet aggregation, ordinary stress was sufficient to tip the balance. 7 habits, all of them ordinary, all of them in routines that feel responsible and health conscious from the outside. Each of them adding to the morning cardiovascular burden that the research has identified as the most dangerous physiological window of the day. None of them requiring dramatic lifestyle change to address. 30 seconds at the bedside before standing, water before coffee, a warm-up before vigorous exercise, blood pressure medication taken before the morning surge peaks, a screen-free first 10 minutes. They are the adjustments that change what the morning cardiovascular window looks like. And for a cardiovascular system managing the silent vulnerabilities that most adults over 60 carry without diagnosis, they are the adjustments that determine whether the morning passes safely or becomes the morning that changes everything. Now we want to hear from you. Which of these 7 morning habits surprised you most? And how many of them are part of your current morning routine? Share in the comments below. We respond to every single one. Subscribe if you haven't already. Next week, we are covering the 9 warning signs in your hands that indicate your cardiovascular system has been declining for years without producing any symptoms anywhere else.